Doctor, it feels like something is tearing inside my chest. This is not ability. This is not acidity. This can kill in minutes. Aortic dissection is when a tear develops in the inner layer of the aorta. Blood enters the wall and splits it into two layers, true and false lumen. Can lead to rupture and it can lead to cardiac sudden death. Think of the aorta like a high pressure water pipe. If a small crack forms, water enters the wall and tears the pipe apart. What is happening? Blood creates a false channel, false lumen, reduces flow to vital organs, risk of rupture. Who is at risk? Severe hypertension, elderly patients, connective tissue disorders, Marfan syndrome. What are the classical symptoms? Tearing chest pain radiating to back. Sudden onset, may have unequal BP in arms. How to diagnose? CT angiography. This is the gold standard. Echo in emergency. There are how to treat. Type A, there is an emergency surgery. Type B, medical management, BP control and ICU care. This is not just pain. This is your artery screaming. So you have to control your blood pressure strictly. Don't ignore sudden severe chest pain. Early hospital visit saves life. Aortic dissection doesn't wait. Every minute matters.